A cough is a symptom, not a disease in and of itself, that's often indicative of an underlying condition. A cough can accompany a common cold, for instance, or be due to allergies, lung disease, or even gastrointestinal troubles. By paying attention to the details, the sound of your cough, for instance, along with accompanying symptoms, you can often identify the cause, which is important for getting on the road to recovery. Following are 7 common reasons for a cough, and what to do about them. Postnasal drip. A cold or allergies can cause mucus to drip down your throat. This postnasal drip can touch on nerve endings, leading to either a wet or dry cough. A cough due to postnasal drip will usually be worse at night, and you may also have a tickle or scratchy feeling at the back of your throat. If allergies are causing the postnasal drip, you may also have itchy eyes and sneezing. If you have postnasal drip accompanied by congestion, pressure in your face, cold symptoms lasting longer than 10 days, and thick green or yellow mucus, you could have a sinus infection. In this case, irrigating your sinuses may help. It appears to work by thinning mucus, decreasing swelling in your nasal passages, and removing debris, bacteria, allergens, and inflammatory substances from your nose, hence decreasing swelling that makes it hard to breathe. To make your own preservative-free saline solution, just add 1 teaspoon of Himalayan or sea salt to 1 pint of distilled water. Make sure you use a saline solution that does not contain benzalkonium, a preservative that can impair your nasal function and might sting and burn. Asthma. A dry cough coupled with a rattling or wheezing sound is often a sign of asthma. In this condition, your airways become inflamed, leading to wheezing, coughing, and difficulty in breathing. Cough due to asthma typically worsens at night or while exercising. It may be accompanied by chest tightness, shortness of breath, and fatigue. If you have asthma, I suggest looking into the Buteyko method, which teaches you how to bring your breathing volume back toward normal or, in other words, to reverse what's called chronic hyperventilation or chronic overbreathing. When your breathing is normal, you have better oxygenation of tissues and organs. Optimizing both your gut health and vitamin D levels should also be at the top of your list if you're suffering from asthma. Gastroesophageal reflux disease. After food passes through your esophagus into your stomach, a muscular valve called the lower esophageal sphincter closes, preventing food or acid to move back up. GERD, also sometimes referred to as acid reflux, occurs when the LES relaxes inappropriately, allowing acid from your stomach to flow backward into your esophagus. A GERD-related cough is likely to become worse when you're lying down or eating. It may be associated with other GERD symptoms, such as heartburn, but in 75% of cases, chronic cough is the only symptom. Eating large amounts of processed foods and sugars is a surefire way to exacerbate GERD, as it will upset the bacterial balance in your stomach and intestine. Chronic obstructive pulmonary disease. If you're chronically coughing and hacking up lots of mucus, your cough may be due to COPD. Typically, the cough will be worst in the morning and ease in severity throughout the day. You may also experience shortness of breath, wheezing, fatigue, and chest tightness. Smoking is a major cause of COPD, which includes both emphysema and chronic bronchitis. In emphysema, the air sacs in your lungs eventually lose their elasticity and start to worsen. Chronic bronchitis happens when there is a swelling in the linings of your lungs, and it constrains your breathing. Medication-related cough. Drugs known as ACE inhibitors, which are used to treat high blood pressure, can cause a dry cough in about 20% of patients. If you noticed your cough a few weeks after starting this medication, it could be to blame. While you shouldn't stop blood pressure medication without your doctor's guidance, it's important to be aware that high blood pressure can often be remedied with lifestyle changes. If you are diagnosed with high blood pressure, dietary strategies will be crucial to controlling your levels. One of the primary underlying causes of high blood pressure is related to your body producing too much insulin and leptin in response to a high carbohydrate and processed food diet. Pneumonia. Pneumonia starts out as a dry cough but progresses into a wet cough with yellow, green, or red mucus. Your cough may be accompanied by fever, chills, trouble breathing, or pain when coughing or breathing in deeply. Anytime you cough up excess mucus and phlegm, spit it out rather than swallowing it, as swallowing excess mucus can cause irritation to your stomach. Most people with pneumonia can recover safely at home by drinking lots of fluids and getting rest. However, in severe cases, in the elderly or in young children, pneumonia may require hospitalization to receive fluids, breathing treatments, and oxygen therapy. Pneumonia may be caused by a virus or bacteria. Although antibiotics are sometimes given, they will not be effective for viral pneumonia. Whooping cough. Whooping cough causes a severe cough that ends with a whooping sound as you breath in. CDC data shows 84% of children under the age of 3 have received at least 4 DTaP shots, and yet, despite this high vaccination rate, whooping cough still keeps circulating among both vaccinated and unvaccinated individuals. The vaccine is clearly ineffective, and it's not just failing to prevent whooping cough in the US. In the UK, researchers similarly revealed that nearly 20% of fully vaccinated children still contracted whooping cough. If you think you have whooping cough, you should seek medical attention right away, especially if it occurs in a young child. However, there are some natural treatments that may help, and certainly won't hurt.